Hello everyone, welcome to Pharma Icon and the today's topic is what are the one line importance for pharma exams. Okay, one liners. So from the given following subjects, what are they? Pharmacology, pharmacognosy, pharmaceutical analysis and medicinal chemistry. Okay, and the first one is for standardization of Karl Fischer reagent, we need to use sodium iodide. Okay, for standardization, we use the sodium iodide. Okay, for standardization of Karl Fischer reagent, we use sodium iodide. Okay, first, what is Karl Fischer reagent? The Karl Fischer reagent is a type of reagent which is mostly used to identify the moisture present in the given substances. Okay, this reagent is used for the determination of water content in the substance. Okay, so why we need to use sodium iodide in the standardization? Because by using the iodine, so with the help of iodine they determine the how much amount of water present in the given sample. So hence the sodium iodide is used for the standardization of Karl Fischer reagent. Okay, next, the column efficiency depends on the height equivalent to a theoretical plate. Okay, in that column chromatography we use HETP for the determination of column efficiency. Okay, what is HETP? High equivalent to a theoretical plate. We can use this plate for the determination of column efficiency. And what is column efficiency? Okay, the column efficiency is when we perform a chromatography. What is chromatography? Chromatography is a type of technique which is mostly used to isolate the compounds or to identify the different types of components from a mixture of components. Okay, so by performing the TLC we can identify the compounds here. Okay, here is a one component and here is a another components. So the movement of the compound is depend upon their relative affinity. Okay, so this distance can be easily defined as a column efficiency. Okay, how much the components can be separated through the chromatography. So we can measure the bond length of the compound, that is called as a column efficiency. And the next one is the most intense peak in the mass spectra is called as a base peak. So what is the intense peak? Is the base peak. The intense peak we call as a base peak. So what is intense peak? The intense peak means when we perform the mass spectra, the highest peak. Okay, the highest range of peak is called as a base peak. So how much amount the peak is to travel, that highest range of peak is called as a base peak in the which spectra? Mass spectra. And the next one, the thiamine is a vitamin that is basically by all cells for the growth. Okay, the thiamine is what? Thiamine is a B1 vitamin which is one of the essential vitamin for the growth of the cells. Okay, so the thiamine is one of the important element for the growth of the cells. Okay, thiamine is one of the important vitamin which is mostly help for the growth of the plant. Okay, next, eugenol. What is eugenol? Eugenol is a chemical substances which is mostly present as a natural derivative in some plants like tulasi and clove, cinnamon, nutmeg. So it is a chemical substances which is naturally present in some of the plants. Okay, like tulasi. And the next one is about purity of water can be assessed by determining its conductivity. Okay, purity of water, how you need to say this water purity? Okay, by performing the conductivity. What is conductivity? Conductivity can be defined as the capacity of that water is need to conduct the electricity, okay, which is conduct the electricity, okay. Based on conductivity we can determine the purity of the water, okay. And by this conductivity also we can identify the how much amount of saltiness present in that water, okay. Next one liner is schedule M is mostly describes the good manufacturing practices. First of all, what are schedules and how many types of schedules are there? According to the Drug and Cosmetic Acts 1940 and the Drug and Cosmetics Rules 1945, they given about the different types of schedules. From schedule alphabet A to Z, there are different types of schedules. Total 24 schedules are there. They are mostly used to describe the different types of categories of the products, okay. In that schedule M is mostly represent the good manufacturing practices, okay. M represents the manufacturing practices. And the next point is measurement of inulin is the renal clearance is a measure of glomerular filtration, okay. Measurement of inulin renal clearance is the measure of glomerular filtration rate. So first of all, what is renal clearance? The renal clearance is by using the plasma, okay. With the help of plasma we can determine the how much amount of waste material is removed through the kidneys, okay. That is called renal clearance, means the waste material is to be clear from the renal means what? Kidneys, okay. So that rate we call as a glomerular filtration rate. And what is glomerular filtration rate means? It is a type of blood test in that how the working condition of the kidneys per 1 minute, okay. What is the working capacity of the kidneys for 1 minute? So that is called as a glomerular filtration rate. Next point is the role of borax in cold cream is in situ emulsifier. What is borax? The borax is act as a cooling agent. So it is used in the cold cream for which purpose? Which is act as an in situ emulsifier. So what is in situ emulsifier? In situ emulsifier means it is a type of agent which is spontaneously form the emulsion by using the water and oil agents, okay. That is called in situ emulsifier. And the next one, heparin. Heparin prevents. Heparin is what? It is a blood coagulant agent, okay. Heparin prevents blood coagulation by inhibiting thrombin catalyzed conversion of fibrinogen to fibrin. Heparin which is mostly converts the fibrinogen to fibrin, okay. By what? By act as an anticoagulant action, okay. What is anticoagulation? Which prevents the clots, okay, blood clots. Next, the anticoagulant action of heparin sodium injection IP is estimated by using the sheep blood, okay. First we know heparin act as an anticoagulant, but how the chemical sodium heparin injection is act as an anticoagulant? How can you determine? We can determine by performing the IP test against the sheep blood. By using the sheep blood we can determine the capacity of the heparin sodium injection, okay. And the next one, the combination suggested for the treatment of leprosy is dapsone drug with clofazimine along with rifampicin, okay. By using these combination of 3 drugs we can suggested for the treatment of leprosy. What are the drugs? Dapsone, clofazimine and rifampicin, okay. What is leprosy? Leprosy is a type of bacterial disease which is caused due to the Mycobacterium leprae, okay. This leprosy treatment can be done by performing these combination drugs like dapsone, clofazimine and rifampicin. And the next one is mechanism of action of digitalis is enhanced by the sodium potassium ATPase. So what is the action of the digitalis? The digitalis is act as a cardiotonic agent. So what is the mechanism involved in this? The digitalis is mostly inhibited the sodium potassium ATPase. So sodium potassium ATPase is a type of an enzyme which is mostly reduce the sodium potassium levels in heart, and which is leads to the reduction in the heart's level of contraction. Okay, it is act as an inhibition enzymes and increases the levels of intracellular cations. Okay, these sodium potassium levels may be increased by using the digitalis and reduce the heart contractions. Okay, and the next one, the amount of barbolin present in aloe vera is 3.5% to 4%. Okay, first of all, what is barbaloin? The barbaloin means it is a type of chemical substances. The first, when we cut an aloe vera, the yellow color juicy liquid layer which is expelled out from the aloe vera, okay, that is called as a barbaloin. The barbaloin is a yellow colored fluid which is act as a chemical agent which is mostly present in the aloe vera. Okay, how much percent it is? 3.5 to 4%. And the next one is digitalis toxicity is enhanced by co-administration of quinidine. When we administered a digitalis in more amount, that can be tolerated by co-administration with the quinidine. Quinidine is a type of drug which is enhanced the toxicity levels of digitalis. Okay, the digitalis can be act as a cardiotonic agent, means which is mostly used to treat the heart problems. Next, vitamin K is coagulant. Okay, vitamin K which is mostly act as a coagulant. Next, warfarin is anticoagulant action. What is coagulant? Coagulant means the process in which the blood clot is formed. So vitamin K is helpful for the formation of clotting, whereas warfarin is anticoagulant in action. Warfarin is opposite the action, so warfarin is cannot helps in the prevention of clotting. Okay, so vitamin A and warfarin both are important for the blood. Next, mechanism of action of thrombolytic agent is conversion of plasminogen to plasmin. So what is the action of thrombolytic agents? The thrombolytic agents means they are mostly convert the plasminogen to plasmin. So the plasminogen is converts to plasmin. Okay, this is the mechanism of action. The mostly it can be done by the enzymes like tissue plasminogen activator. By using with the help of a tissue plasminogen activator, it converts the plasminogen to plasmin. Okay, this is the today's important one-liners for this session. So thank you. Please do subscribe Pharma Icon.